Hey, Uncle Vinny. Tonight's Monday night. You know what that means? Health chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
Everybody, it's Monday night. I'm Dr. Nick Circolone. You're listening to Health Chat. Without further ado, let's get started. I've been thinking about talking about some things this week, and I've had some patients come in, and they've had hand pain. So what I want you to do, this is an audience participation today. I want you to put your hand up, just like this. And I want you to look at it. I want you to turn it this way, and I want you to look at it. This is one of the most fantastic engineering feats ever created, and it's created by God. And let me tell you something. In this hand alone, we have 27 bones. That's right, 27 bones from here up, 27 bones. And they all work in synergy with muscles, with ligaments, with nerves, with veins, with arteries, with lymphatic system. This whole thing is a engineering marvel. We can grab things and we can build things. We are the only creatures with opposable thumbs that can actually build something. Think about that. Opposable thumbs, which is an opposable thumb, we can do this, that we're able to do just about anything. Now, a lot of patients have pain in their hands. Usually, it's these three fingers right here. What that is usually a carpal tunnel type syndrome. So you were told. Actually, it could be coming from many different sources that can cause a lot of this pain. Now remember, a little bit of median nerve will cause tingling and nerve irritation. So let's kind of trace the median nerve from its origin and the cervical spine. It's at C5, C6, and kind of incorporates C6 and C7, which causes radicular pain, which is pain that actually runs down into that area. Some patients have tingling and irritation from the elbow to the hand, or you have it from the wrist and the hand all the way up. Now, if it's going backwards, that is usually a true carpal tunnel. When it's coming down, it's usually the median nerve being compressed at a different area. Usually, it's compressed in the cervical spine, in the shoulder, in the elbow, or in the wrist. So, how do we break that down? How do we kind of unpack all of that and figure out, is it coming from my wrist? Is it coming from my elbow? Is it coming from my shoulders? Is it coming from my neck? Is it a true carpal tunnel? Is it a repetitive strain type injury? All of these have the same symptoms. So we have to break that down. I was asked a question, Doc, you talk a lot about extremities and other areas of the body besides the neck and the back and the mid-back. Why? Well, if you've been tuning in, if you've been listening, you have to understand I have a fellowship in orthopedics. So as most chiropractors, they'll do neck, low back, mid-back, the spine. They're concentrating on the spine. Whereas my training has allowed me to expand further into different areas of the body. What that means is, what a chiropractic orthopedist is someone who has actually gone through 3.5 years of extensive training, plus we've taken a national board exam in order for us to be called fellowed or diplomates in orthopedics. And what we do and what I do in my office, I can't speak for every chiropractic orthopedist, but I do know a lot of us are in hospitals. A lot of us have practices where we're multidisciplinary practices, such as mine. And we're like kind of that middleman between chiropractic and medicine. My job is to be able to fix people or get people well by not doing surgery. If I can avoid the surgery, we're going to avoid the surgery. However, if you need surgery, I'm one of the first ones to actually make sure and you get that surgery. So now that that's out of the way, let's talk more about the hand. And we're specifically talking about the hand today and numbness and tingling. I will tell you where it can come from and how we can treat that. So let's start out. Remember, 27 bones in the hand, right? Why are there 27 here? Because we have 3 bones. We have the ulna, and we have the radius, and we have the humerus. That makes up 30 bones in the upper extremity. Now, If they are not moving in synergy or moving well together, we will have issues and we will have problems. We can adjust the bones of the wrist. We can adjust the elbow. We can adjust the other bones in the upper extremity. So not only can we adjust the cervical spine, but we can adjust every other joint going down there that may be causing irritation or compression to those areas. So let's start with radicular pain coming from the cervical spine. If you have a C5 or C6 lesion, which is causing pressure on the nerve, you will get that numbness and tingling into the hand. Now, usually it's these three fingers. As we go down and into the shoulder, you have what's known as the teres minor muscle. That's one of the rotator cuff muscles, and it is located right here. If you've ever had somebody press on that area, it will literally light you up. I have patients come into the office that I work on, and they're like, "Doc, please stop." I'm talking big guys as well as not so big guys and women, that it actually hurts so much. And usually it comes from working out. Usually it comes from a repetitive motion that you do with the shoulder. But that muscle will irritate the nerve, and you'll get tingling either in the whole hand or in the lateral aspect of it, in the pinky and the ring finger, okay, and sometimes into the middle finger. If it's the median nerve being compressed, remember, it's going to be these three fingers. So if you have any of these problems and you've been told you have carpal tunnel, I would get a second opinion. The reason why I would get a second opinion is because I have patients that come into my office that have had bilateral carpal tunnel. Bilateral. When I see someone who has bilateral carpal tunnel, I get little question marks go off in my head. Is it really bilateral carpal tunnel, or is it coming from another area? And what we find is that even after they have carpal tunnel surgery, they're still having the same kind of pain and symptomatology, which tells us it's coming from somewhere else. Now, a lot of times this could be misdiagnosed. So that's why you need to get a second opinion. And by getting a second opinion, you're going to avoid having to have surgery. The reason being is it can be coming from the cervical spine because we have two nerves, median nerves, that exit that area that go down into the right hand and into the left hand. And if any of that's irritated, you're going to get bilateral type of symptomatology. And sometimes it's unavoidable. Some people have a job where they're using their hands all the time, and what happens is they do get bilateral carpal tunnel. But a lot of times it's not. Sometimes what we get is what's known as a repetitive strain. If you're using a hammer, a screwdriver, you're typing on a computer, you will get what's known as repetitive strain. Now, that is kind of an easy fix. It's a real easy fix because now it's more of a muscular problem that we can deal with. The muscles in the forearm compress, get tight, and what happens is it affects that nerve by compressing that nerve, creating irritation. There's not much space in the forearm for the artery, for the vein, for the adipose tissue, for the nerve. All of that is squeezed in there. Plus you have muscles and you have ligaments, you have other fascia and soft tissue. Anything that can compress that area will cause pain and tingling into the wrist and fingers. So what we have to do is we have to examine that forearm and make sure it's not coming from the forearm. We also have to look and make sure it's not coming from the wrist. If you have a misalignment of the carpal bones, what will happen is it'll compress a nerve or it'll create enough inflammation to cause compression on that nerve, which will cause the same type of symptomatology. So I know what you're thinking. You guys are sitting there going, well, I've had that. You know, I wake up in the middle of the night and my hands are numb. They feel like leather. I can't feel them. That happens a lot. It could be coming from your neck. It could be coming from your shoulder. It could be coming from your elbow or your wrist. A lot of people sleep in a bald position or in a fetal position. Some people lean on one shoulder. Some people lay on their neck and they have it turned sideways. All of these things have to be addressed to find out what's causing the problem. If you're having numbness and tingling all the time, that's something that's probably being caused by an area that's compressing that nerve. If you're waking up in the morning and you go, oh, my hands are asleep, sometimes it's more that you slept wrong. If it happens every night, yes, we want to check out, are you really sleeping wrong? Do we have to change the way you sleep? Do we have to change a pillow? Or are you having a structural issue which is being compromised while you're sleeping. So we have to do all of that. So when you come into the office, we have to do a thorough examination. We ask a lot of questions. We want to find out what you do in order for us to fix the problem. That's the key. The key is the better you are at being a historian with your doctor, the better off we're going to be on fixing your problem. And I will tell you this, I try to drag it out of you. I want to find out everything that you're doing, everything that you're not doing, and what can we do to fix it. So, how do we fix that? Well, there's several ways we can do that. One, we can adjust those areas. Number two, we can do modalities on that area, which is ultrasound or e-stim. I don't do that often because I find that it doesn't help as much as manually getting in there, working the muscles, getting in there and breaking up the trigger points. We can do what's known as dry needling as well, where we take a small acupuncture needle and we go into the areas that we have a trigger point in, and we break up that trigger point to help relax that. We can tape that area and see if that helps. And fourth and final, most people, we have to say, we need to stop this activity for a period of time to make sure it's not the activity causing the problem, giving you these symptoms. Because over time, repetitive and cumulative trauma to that area will cause irreversible damage in some instances. Remember that. I have numbness and tingling. I'm going to let go and let go and let go and let go. And then we find out, you know what? If you came in earlier, we could have fixed that problem. And now it doesn't have to take forever for it to get to a point. We may not get to 100%. We maybe only get up to 80%. But if you're having the problem and it's lasting for a period of time, get it checked out. Another test that we do, we don't do it in the office. I actually send you to the neurologist for it, is an EMG. Electromyography, and a nerve conduction test. And what we do, or I don't do, but they do, is they test from point A to point B with a little electrical impulse. And they basically give you a little shock and see how far it goes and the speed it travels. Now, it's going to sound like we're talking from something from Back to the Future. The nerve flow that goes through the nerve is called axoplasmic flow. Kind of a cool name. So that axoplasmic flow is measured to see how far it can go from point A to point B. And that is a mean, or the medium, where we find, hey, are we in that groove, or are we out of that groove, or are we below that bell-shaped curve or that groove? Now, if it's a slowing of that area, usually it's a compression of a nerve. If it's a hyperactivity of a nerve, we may be dealing with something else that has nothing to do with the nerve itself. It may be in the upper area of the brain, and that's a whole nother issue that we could talk about at another time. But today, we're going to be talking about the compression. Now, a lot of times you'll get an EMG, and I would say about 90% of the time, it's going to show carpal tunnel. Why does it show carpal tunnel 90% of the time? Well, because we use our hands so much. Our hands, if we did not have the ability to use our hands, a lot of things couldn't be done. We couldn't type. We couldn't build a house. We couldn't work on a car. We couldn't hold our children. There's a lot of things that we do with our hands that causes irritation and inflammation. So when you get the test, sometimes it shows that you have carpal tunnel. And there's the rub. If you have an EMG and it shows you have bilateral carpal tunnel, they go, oh, we're going to have to do surgery on that. Nope, don't do it. Always get the second opinion. But it is very, very important. And if you're going to see a neurologist and you go to see an orthopedist, if they're surgeons, you want another opinion with someone who does not do surgery and has another viewpoint. So if you can avoid the surgery, avoid the surgery. And here's the final thought that I wanted to tell you. If you are a candidate for surgery or have been told you're a candidate for surgery, remember, you can always get surgery. We can always go forward, but it is really hard to go backward. Remember that. It is really hard to go backward. If you have the surgery, can you still get treatment? Absolutely. But the effect of the treatment may not be as good as you could have gotten if you didn't have the treatment. There are a lot of things that can cause numbness and tingling or radicular pain in your hand, and they need to be evaluated to make sure it's not something that's more serious or it's something that can be corrected without surgery. Guys, I hope you have a great week. We love you, and we'll see you next week.